Arthritis is when the cartilage wears away. The cartilage is the articular cartilage is the white material you see on the end of a chicken bone, and that allows a very, very smooth surface as the knee moves back and forth, and cartilage has no pain receptors in it. So when you have cartilage rubbing on cartilage, there's no pain. When the cartilage wears away and bone rubs on bone, that can be associated with pain. And that's part of the process with arthritis. Now, most arthritis is what we call osteoarthritis, which is essentially wearing away of that cartilage over time as part of the aging process. And in some people, it happens earlier than other people. Once the joint is deteriorated, it really doesn't matter exactly how it got there. The person's typically going to be experiencing pain, and the best solution for that pain, at least the most reliable long-term solution, ends up being joint replacement surgery. Among a number of minority patients, there is a sense that I'm older, well, I just can't walk anymore. I got to use a cane, I got to use a walker, and not a feeling that they deserve to be able to remain mobile. So I think that's kind of the message, that with modern technology, there is opportunities for everybody to remain mobile now. Well, there's no doubt that African Americans, Latinos, women are less likely to get treatment earlier in the case of disease or earlier in the course of disease, and there are some studies that would indicate that the outcomes for those groups are not quite as good, although the improvement is just as good. So in other words, as people start at a lower functional state and they make the same functional gains after surgery, if they've been deconditioned for a longer period of time, their ultimate function in those studies is not quite as good. So we've seen that issue with those three groups in particular. Joint replacement's been looked at in a number of different countries. It's been looked at our National Institutes of Health, and it's among the best surgical procedures of all surgery. So a total hip replacement was called the operation of the century in Lancet. So Lancet is a medical publication, not an orthopedic publication, but it's extremely effective at increasing the quality of life of individuals. And there are many people with hip replacements who have what they call the forgotten hip, where they have a tough time figuring out which is their replaced hip, versus which is their normal hip. So it's a very, very effective procedure. It's cost effective. There's some studies there was a recent study on knee replacement that actually demonstrated that knee replacement saves society money, because people are able to stay working, stay independent. Family members don't have to take off of work to care for loved ones. People are less likely to be institutionalized and are able to remain independent. So there's although there's a cost to the intervention, there's some studies that would suggest that it actually is cost saving for society. So they're both very, very effective procedures.